Good morning, everybody. It's AJ here, and as you can see, I have a little helper this morning who's decided he needs to sit on my lap for a minute. His name is Archie, and he is my cat that is a little lover. He will hug you and kiss you. It's crazy. And it's only been, recently, really, that I can handle touching him with my left hand, which is the RSD affected side. I can't pet him yet, but I can with my right hand. So as you can see, he's getting a little bit of loving this morning. But I was sitting here this morning and my alarm goes off for my 9 a.m. meds. And I thought, wow, you know what? I have been doing this for 15 months. And every time I turn around, it seems like my meds keep getting increased. Not sure when or if I will get off any or all of them. And I know so many of you, like me, have the same issues. So I just thought, wow, this is a good topic to just sit back and talk about. I take Neurontin, I take Cymbalta, I take Norcos, I take Elavil, and I take a little bit of Valium in the mix now because my RSD has progressed into anxiety. And it's crazy, but my alarm goes off like 5 times a day for my meds. And my nighttime dose is the most. I think my nighttime is like 6 pills. It's crazy. And I know I'm very fortunate that my car insurance company has covered all of my meds because I know my med is like $1,500 a month every month for all the meds that I'm on. So fortunately, my car insurance has paid for all of them. And I know so many don't have the benefits of insurance, and sometimes your meds go to the wayside because you can't afford them. I just want to let you know that the drug reps do leave samples. They do leave sample packs, sample supplies, just for those that don't have insurance that do need the meds. That's what the drug reps are for. They are there to help. Granted, I know it seems like they're not there to help and they keep raising their prices, and it's a continuous whirlwind of drug companies fighting against each other, and we the patients are the ones that suffer. So just remember, next time you are at your physician's office, whether it's your primary care, whether it is your pain doctor, ask for any samples. And a lot of the drug companies themselves, if you contact them and you are a chronic pain person and you need continuous meds, sometimes they will offer you a program at a much discounted rate, or sometimes they will even send, say, a month's supply to your physician's office just for you to have. I know sometimes it's hard asking for help, but that's what we're here for. The JGF organization is here to help you any way we can. And sometimes it's just to give you little tips here or there, little ideas, things that may make a little difference in your life. I know that I hate carrying around all these meds. I was never one to continuously take meds on a regular basis, but I have to now. I don't have a choice because without them, I can't live. And I don't live the best life right now. I have a good life. I finally have most of my pain under control for the most part. I'm not as active as I used to be, but I'm learning to adjust. I'm learning to make changes in my life. But I just thought, wow, here we go. My 9 o'clock alarm goes off. It's time for my meds. And how many of you set your alarm to go off for your meds? This is my travel pack. This is what, can you see it? This is what goes with me every day in my bag. I keep this with me just in case I'm not home for my mid-afternoon, or if I'm out for the day. And I know I might be a little bit later. My 8 o'clock pills are in there as well. But I go off at 9 o'clock, 12 o'clock, 3 o'clock, I think at 6 o'clock, 8 o'clock, and 9 o'clock. And this is my backup bag. Oh, and the chapstick. This is my backup bag that I keep at home on my counter. This is this has everything. And it was to the point where every day I was taking 1 dose at a time. And then I decided to do the week longs. So I have 5 of these. Yeah, I have 5 of these. I have morning, noon, and night. I have my 3 o'clock doses, and I have my 6 o'clockers. So that everything is labeled. So that way, when I do have a procedure or when I've had surgery, if I'm not quite coherent, whoever is my caregiver that day or the next day knows that this is what time I need to take my meds, because even if my phone is on silent, my alarm still goes off, and it is loud and it doesn't stop. So you have to swipe it, shut my alarm on my phone off, and it's like, hey AJ, take your pills, it's time. So if I can be of any resource to you, any help, anything at all, I'm here. And everybody in the JGF organization is there for you. We are a family. That is what we are here for. So take care, everybody, and, touch base. Let me know what your med times are and how you manage to maintain your routine schedule. Thanks, everybody. Have a great day.